RSNA 2021. My name is Brian Casey, Editor-in-Chief of AmpMini.com. We're here with Dr. Emanuel Kanal of the University of Pittsburgh Medical Center and the American Board of MR Safety. We're going to be talking a little bit about MR safety issues and what MR facilities can do to make a more safer environment for staff and for patients. Dr. Kanal, thanks for being with us today.
Thank you so much for having invited me.
So, Dr. Kanal, you're very involved with ABMRS. Can you talk a little bit about what's going on there and what some of the things are being done? There have been a couple tragic fatal MR accidents this year. What is ABMRS doing to try to prevent some of these things?
In November of 2016, the Journal of MRI published a consensus document from 8 societies and organizations. And in that document, they arrived at a recommendation that any MR scanner which is scanning humans, whether it's clinical research or both, should be overseen. The safety of that scan should be overseen by a magnetic resonance medical director, a magnetic resonance safety officer, and a magnetic resonance safety expert. And it goes through some detail. And over the past 5 years now, that has taken over. And it's essentially now become our standard in how we approach overseeing safe practices in MRI. So you'll find now that a couple of years back, the Safety Committee for the American College of Radiology chose to accept and endorse that approach as well. And so now we're having more and more interest in physicians as well as technologists as well as physicists, and not only becoming more knowledgeable about MR safety, but certifying. We found that we certify everything. I use the analogy: you get on a plane. Imagine getting on a plane and somebody has certified the hardware. They've certified the software for the autopilot. They certify everything. And the only thing we didn't certify is your pilot.
It would be an oversight.
So we decided to form in 2015, actually. I founded the American Board of MR Safety, and we looked for the biggest names in safety internationally. And since we started it in the United States, we called it the American Board of MR Safety, but it's a not-for-profit that now is extremely internationally oriented. And more than a third of the board was international from day one. And all it does is it created examinations for those 3 positions: magnetic resonance medical director, magnetic resonance safety officer, and magnetic resonance safety expert, to certify them that they have passed a test to document their knowledge in the area that they're entitled and that they have a title for and that they're covering. And so the interest in that has been nothing short of astronomical.
Great. Now, do you feel like these efforts are having an impact on MR safety?
It's an excellent question. Yes and no. For those places in the world that have adopted and have decided to take it seriously and implement it, absolutely, no question. You now have, for the first time, a resource that you can turn to and say, hey, is it safe for me to scan this patient? Or well, how would I know if it's safe, and where do I turn to try to find out more about it? For those sites or those countries where it's not yet active, then it hasn't quite necessarily reached there yet. No, I guess there's still a ways to go.
Now, what do you think on an individual basis MRI facilities can do in addition to having these certified officers on staff? What can they do to maintain MR safety and keep their patients safe?
That's a superb question. There's 2 things that we found back 20 years ago, actually 20 years ago, I guess this year, when Michael Colombini was killed with the oxygen tank. The American College of Radiology formed the first MR safety committee, as it were. They called it the Blue Ribbon Panel, and I was asked to chair that panel, and the first charge they gave us is to answer that question. What's happening out there, and what can we do to make it safer? And we did root cause analysis, and we went through so many cases, and our conclusions were really straightforward. 2 things I think sites could really do to make it safer for the patients and for the healthcare practitioners in MR environments. In no particular order, they could ensure that the MR practitioners are sufficiently educated and knowledgeable about the safety issues. There's so many sites that we've had. Let me rephrase it. MR is very, very, very safe. There's almost never a safety issue. The problem is that, number one, when it does happen, it can be extremely serious. And number 2, virtually 100% of the time, it was avoidable. It didn't have to happen. And that's the reason why there's such an emphasis on it, because You didn't have to have that Michael Columbini tragic outcome. You didn't have to have a burn. You didn't have to have the hearing loss. So many of these things that they're so rare, they almost never happen. But when they do, what a shame.
It really, you see the headlines, yeah.
So if you could at least have people understand, I can't begin to tell you how many dozens, literally dozens of cases that I've been involved with in my career where, let's say, a burn has occurred, a second or third degree burn, and the site says, wait, we didn't even know that it was possible to burn somebody in MRI. If we could educate them, step number one, minimum level of education as to what are the risks associated with MR, what are the energies that you're using, what are their risks, where are they, when are they being used, and when are they present, and how do I mitigate them? Education. The first step is to do something to educate the end users. And finally, the second step is adequate site access restriction for the uninitiated, for the public, for cleaning facility, for cleaning the people who will clean the facility, people that are not based in MR, physicians and other services that don't know how to appropriately treat the energies in the MR environment, accompany them or restrict them, and make sure that there's always somebody overseeing the site.
Okay, perfect. Well, Dr. Kanal, some great thoughts, and let's hope that we're getting a better handle on this issue.
Thank you. My pleasure.
Great. Signing off for AmpMini.com, my name is Brian Casey.